If your knees feel stiff, achy, or inflamed, especially after activity and you've been told you're too young for knee replacement, this video is for you. Many of the patients I see are active adults who used to ski, golf, play tennis regularly, and now their knees really hold them back from doing those activities. They've done physiotherapy, they've tried injections, and they're told to wait until it gets worse. What I want to explain today is why that approach often fails and what should be evaluated before surgery becomes the only option. Most people are told that knee osteoarthritis is simply wear and tear and that cartilage doesn't heal and pain is inevitable with age. But here's what's often missing from that explanation: stability. Many people with knee OA have had a knee injury years ago, sometimes decades earlier, and maybe it was a sports injury, maybe it was brushed off. If the ligaments and tendons never fully healed, the joint can become subtly unstable, and over time that instability changes how the joint loads, and that really accelerates degeneration. Most people are told what they have, but never why they have it. This also explains why so many people develop symptoms in both knees. Even if one is worse, when one isn't stable, your body does compensate. You load the other side more, and over years, both joints can start to break down. So it's not bad luck, it's just biomechanics. Physiotherapy is really excellent. I love physio for muscle strength and movement, but muscles move joints. Ligaments are what stabilize the joints. So you can strengthen around an unstable joint, but it doesn't make the joint stable. Like you can strengthen around a loose hinge, but it's still a loose hinge. Steroid injections reduce inflammation temporarily, but they don't address instability. And actually, repeated injections weaken tissue over time. We have tons of research that supports that. And here's a really frustrating part. Many people are told they're too young for a knee replacement. Surgery is really reserved for the end stage degeneration, and waiting does not pause the problem. There's often a window where identifying instability early can change the trajectory. So the goal is to understand what's actually driving the stiffness, inflammation, and pain before the joint reaches a point where surgery actually is the only option. So the next step isn't guessing, it's an assessment, specifically determining whether joint instability is contributing to your knee pain and stiffness. So if you're local to Calgary or you're willing to travel to Calgary, you can request an initial assessment where we evaluate knee stability, review imaging if needed, and discuss appropriate options. If not, I hope this at least gives you some clarity on questions that you should be asking.